Hi, I'm Hank Levin, and I want to show you some things about the InnerTrac, about its basic function, so that when you see it in actual use in a demonstration, you understand what you're looking at. First of all, what it measures is the changes in the skin resistance. This is important because the skin resistance changes abruptly depending on what you're thinking and what kind of thoughts you're thinking, what kinds of emotions you're feeling. Now, this has been known since the early 1900s, actually before that, but only recently we figured out what we should be able to do with it to make it help us in counseling and in understanding the mind. So I'm going to show you the different parts of it and give you an idea of what they do. This, of course, is the on-off switch. Okay, and the LCD window, liquid crystal window, has a number in it. And this is the range. This is the overall skin resistance, and it's also called a baseline in psychology. And it's only really important insofar as the change. The number itself, the value that you see in there, it's going to be from 0.5 to 6.5, and it's only really important insofar as it changes in response to what we're doing in a session. It's not like you can hook somebody up to it and get a reading and tell something about them. But when you see it changing, that's important. Now, the most important aspects are these 6 lights that you see. And to start with, the first light goes on when a person is starting to get uptight. This indicates the presence of a thought which is there. They often don't know the thought is there, but they're not comfortable with it, and they're not comfortable enough to actually see it consciously and have it discussed. Like we said before, people have thoughts and they don't know that they're having them. So when a thought comes in and the person is not really comfortable with it, this yellow light goes on, and it represents the kind of feeling you get when someone starts talking to you and you don't want to talk to them, or you have something else that you should be doing and you don't want to be impolite, but you're sitting there waiting for them to finish, don't know how to interrupt them, and you feel more and more and more uptight. That's the feeling that it represents. It could also indicate the presence of, increasing presence of a thought that produces fear or upset or disappointment or something like that. But it's an indication of something that's not being resolved. Now, these 3 lights work together. These are the discharge lights. And a small discharge gets 1 light, and a medium discharge gets 2 lights, and a large discharge gets 3 lights. And those are very important because they show 2 different things. When you mention a subject that the person has an issue with, they don't have to be conscious of the issue. In fact, they usually aren't. But if they have an issue with it, you'll get some degree of momentary discharge. And from doing this, you can actually assess from a list of things that might be bothering them and find out which is the most significant one, or which one they have most negative energy with, and deal with that. So it's very good in that respect to know what these are showing you. Now, the other thing that happens with these 3 lights is when something actually becomes resolved through addressing it or dealing with it or talking about it or tapping or any kind of technique that we use to get rid of the negative energy connected to it, all 3 lights will come on and they'll blink and then they'll stop, but this number will go down. That's a reset. Okay? And that indicates that something has been partially resolved or possibly thoroughly resolved. Okay, so when you see these lights all blink up, all light up and then start blinking and then stop, and this number changes, goes down in value, that indicates that something has been released from the person's mind. Something has been resolved somehow, or they've transcended an issue. Now, if they fully transcend the issue to where they feel okay about it, where they didn't feel okay before, this light will come on. It's a white light, and this is the release light. It's an indication that they now feel better about the subject. And it's important to be able to note that, because sometimes when you're doing a therapy with them, like a tapping therapy, or on yourself, if you're using it on yourself, there's a point that occurs where they suddenly feel good about it. They have a realization. And that light will very likely come on. At that point, you want to make sure that you acknowledge what happened. You want to ask them, do you feel any differently about the subject? Because if you keep going, they'll start to feel glum again. You'll go past the point where you accomplished what you set out to do. And it's important to know about that. So that's the significance of the release light, the white release light. There's a red light over here, and it's an upset light. And this will go on momentarily when a person feels upset during the session. Now, whatever kind of therapy you're doing, if the person is upset, especially if they're upset with you, it's not going to work. And so if this light goes on, you want to ask them what's going on. What's happening? Is anything bothering you? Are you upset with something? Have I said something that bothered you or made you upset? And get them to talk about it until this is no longer occurring. And you'll find out what it is. So this is very important to understand, even though it comes on very rarely. The red button is used to reset this activity. If you're asking questions, for instance, if you're asking questions off of a list trying to find the thing with the most charge, you can't do it while it's in the middle of a reset action. So if you have lights blinking and you've seen it and you don't need to see it anymore, but you want to get ready for the next question, you'll push this red button and you're ready to ask the next question. It's a reset button. We don't use it all the time. This knob is sensitivity. And so if you're talking to the person and nothing seems to be moving, none of the lights are going on or blinking, you might want to increase the sensitivity of the unit, and so you turn this knob up. On the other hand, if as you're talking to them these lights are blinking and resetting so much that it's hard to figure out what's happening, you'd want to turn this down to the left to make it a little less sensitive. Those are the basic controls. And so we'll see how those work when we actually do a little session demonstration.